President Cyril Ramaphosa, speaking at an ANC manifesto Q&A session, says he will speak to UK Prime Minister, that is, Boris Johnson. It's after the country placed South Africa on its coronavirus red list, forcing travellers from South Africa into a pricey hotel quarantine upon arrival in Britain.
On the issue of the UK putting us on a red list, I think this is the most unfortunate situation that we've been subjected to. It is, I understand, been done by their own scientists, less done by politicians, but by their own scientists who have been tracking the whole world, looking at the incidence of infections around the world. So they also put us on their radar screen. And the concern that I'm told they had or have is that the beta variant, which we also had at the time, which does not sort of respond well to the vaccines that they are using, they thought that the beta variant had continued to mutate in South Africa, and yet that is completely untrue. I'm due to speak to Prime Minister Boris Johnson, and we've been getting our officials to speak, and our officials have met their people, both at the political level and at the scientific level. So this is being handled, it is in process.
Let's stay with that interview. Ramaphosa says the blacklisting has dealt a crippling blow to tourism in South Africa, a key sector accounting for 3% of the country's economy.
We do not have the need to retaliate. We don't have such a need. The UK is an important trading partner to South Africa, one of the very important ones. So therefore, we don't feel the need that we should retaliate. We should rather engage. And through our engagement, we are hoping that we will find a solution. Because it is both in our interest to find a solution to this, but it was more scientifically driven rather than politically driven. There are those in our country who are jumping up and down and thinking that there's politics behind it. There's no politics, it's just a science. And it is possible that the scientists have not been paying the close attention that they should to the developments around our management of COVID-19.
All right, let's get you some perspective on this red listing issue with Dr. Nicholas Crisp, who is the Acting Director General in the Department of Health. Dr. Crisp, thanks very much for your time indeed. It does sound on the face of it that the discussion has moved somewhat, at least so far as the UK using our own research here in South Africa to inform its decision around our red listing.
Yeah, good morning and morning to the viewers. So what was explained to us is that the UK has a science committee. It's a joint biological centre, they call it, and they're busy transforming it into a full agency at the moment. And what they do, as the scientists in their country, there are about 40 of them in this unit, who are reviewing the genomic sequencing data and other information from around just over 260 countries around the world, they explain to us. And whenever there's major movement of any genome sequencing in any of those countries, they flag them for more intensive investigation, and they review between 10 and 20 on a 3-weekly cycle. This is their process that they've explained to us. So we have been explaining to them, together with quite a high-power delegation of our scientists, how we go about doing our genomic sequencing, what we have found, where we publish it, how frequently we publish it, the gap between the collection of the data and the publishing, the way in which we work with our neighboring countries, because there's a lot of movement in Southern Africa in particular. And so it was a purely scientific discussion about methodology and sharing. So the people involved in South Africa and the UK are colleagues. It's a very small international scientific community, really. So they all know one another fairly well, and it was a very collegial conversation around the science of what we know and where we are at the moment.
Is it fair to say that the meeting in large part was almost like our scientists convincing their scientists that we do actually have good and extensive knowledge around epidemiology on COVID-19 in our country?
Yeah, well, I think we must also understand the UK is not only looking at us, we are one of the countries, but yes, we were explaining the degree of confidence that we have in our data, not just in the outcomes of the data of what gets tested in the lab, but that the samples that are taken are truly representative and they are geographically collected in a way that we would detect if there were something that would be of some interest or bother to them. So as the President's clip said, they are concerned about the beta variant. We have also been watching the beta variant closely over the months since July. And in the month of September, there was not one single specimen of beta detected amongst the sampling that we did across all the laboratories that are part of this process. So we are confident that that is not a threat in South Africa and nor for travellers from South Africa to other parts of the world. And
all of the information that you've just outlined, I mean, it's the kind of information that the UK would need to make decisions around our own red listing. Is this a lesson for all of us that we need to perhaps have closer and better relationships with countries like the UK when it comes to sharing of this kind of information?
Well, all the data is published immediately that it becomes available on a global site. This is the way in which we manage epidemics and especially pandemics like this, which are across the whole globe. If the data from all countries is not available for everybody to see, we're not really able to track what is happening. So we do publish the data immediately. It is readily accessible to everybody. The question is really around whether they feel confident in the sample sizes, the timing of the specimens, the delay before the specimen is actually processed and arrives on the database, etc. And so they were seeking clarity from us on exactly the technical process of how we go about doing that when the data gets published. As I said, there's a lot of movement between our neighboring countries and ourselves, so they also wanted to be confident that we are able to detect any beta variant or any other strange variant that might arise from the movement of people around, into our borders and in our trade in Southern Africa. And because we are extremely closely involved with our neighboring countries and in fact involved in the training in their laboratories and so on, the network here in Southern Africa is very, very strong, and we were able to explain it at a very detailed and personal level, which our colleagues in a political space would not be able to explain. So I think it was very useful, it was collegial, and we have now got everybody directly in contact with one another and sharing data at a very detailed scientific level. In terms of our own vaccination rates in the country, we've been talking about this red list issue, particularly because it dealt such a major blow to our tourism economy, which contributes so much to GDP. What were the discussions on Monday around our vaccination rates so far and perhaps where we need to be? No, there wasn't any specific discussion. The UK here and the High Commission is well aware of what we're doing, and because they are physically in South Africa, their staff also participate in the vaccination program and have been involved in that. They know that we use two vaccines, Johnson & Johnson and Pfizer, as our mainstay, which is different from the AstraZeneca vaccine that they use as their mainstay in the UK. But they have never been uncomfortable with our vaccination program at all, so that wasn't an issue. So Dr. Crisp, while we have you on the line, and I'm sure you would have been expecting this, we'd like to ask you a few questions around the Digital Vibes saga, the SIU's report, which was released by the President just yesterday. We understand today is D-Day, so to speak, for the Department of Health to respond to the findings from the SIU. What can you tell us about, what's going on in the background right now at the Department of Health insofar as that response is concerned? Well, as the press release or the press notice said, the Minister will be making an announcement at 11 o'clock. We'll be together at the GCIS collective, with all the journalists who have been invited, and we will make an announcement then.
Are you able to comment now about how this entire saga has affected our handling of the pandemic, perhaps even so far as our vaccine rollout plan?
No, it hasn't affected. We work very closely with the provinces, and the provinces are the bulk of where the work takes place. We've got a very, very strong relationship with our private sector, which has grown tremendously during the pandemic, and they have a big vaccination program, and we've been able to maintain the momentum up to a point. Now, of course, we are trying to gear up for another big drive, and this has got nothing to do with that other campaign.
You're acting in the position of Director General, Dr. Crisp, exactly because of the issues around the Digital Vibes saga. Sandile Buthelezi faces disciplinary action as we understand it. I mean, surely that must have somewhat of an impact on the running of the department itself.
Well, it's from a personal perspective, it makes me very busy, but there's a marvelous team. I've got to know them very well over the last few months, and we share information, and they've been great in taking some of the workload that I was carrying away from me, so that I can get on with some other things in the department. The rest of healthcare goes on. There are decisions to be made. There are things that need to be done. There are budgets to be prepared for next year and reports to be done. So, yeah, we all club in together, and I must say the senior management have been extremely supportive, and we're doing fine.
So 11 o'clock this morning, you say, is when the Minister will be giving the Health Department's response to the SIU report?
That's correct.
Dr. Nicholas Crisp, let me thank you for your time this morning on the AM report. He is the Acting Director General in the Department of Health, speaking to us there about a range of issues. The most important of those is the issue around the UK red list. That was the topic of our discussion there. Also asking Dr. Crisp some questions around the SIU report into the Digital Vibes scandal. He says there's a great team in the background that's tried to ensure that the scandal hasn't impacted the running of the Department of Health. 11 o'clock this morning is when we're set to hear from the Health Minister.